Well, good morning, everybody. Thanks for being here. My name's Joe Bolcom. I'm a member of the Iowa Senate from Iowa City. I'm pleased to be joined by Representative John Forbes from here in Urbandale, Polk County. Iowans are suffering today with debilitating, life-altering conditions like cancer, Crohn's disease, multiple sclerosis, severe and chronic pain, and Parkinson's disease. Even after receiving the most advanced medical care and the most effective prescription drugs ever, they continue to suffer. These Iowans deserve better. Unfortunately, after 5 long years, Iowa's medical cannabis patients continue to needlessly wait for access to affordable medicine they need. That is why Governor Reynolds' veto of the modest improvements to Iowa's medical cannabis program is so heartbreaking to sick, vulnerable, in some cases dying Iowans. Today, we are calling on our fellow Republican and Democratic legislators who have voted for these modest reforms to join our efforts to support Iowans who need relief from debilitating, life-altering conditions. Listen to those Iowans and their families, not the faulty reasoning of Governor Reynolds. The veto by Governor Reynolds is irrational and lacks compassion for the very patient the program seeks to help. The legislature worked together on a deeply bipartisan plan to make meaningful improvements to the program. Unfortunately, Governor Reynolds failed to do her homework. She instead relied on the discredited advice from the Iowa Medical Cannabidiol Advisory Board. Their recommendation on limiting THC would make the current struggling program ineffective to more than half of the existing patients. Governor Reynolds claims that the scientific data do not support a higher THC limit is simply untrue. Multiple studies exist to refute her claim, as well as the real-life experience of tens of thousands of medical cannabis patients living with debilitating conditions in 32 other states that allow access to medicine with higher purchase caps than House File 732 would allow. Today, more than 70% of our current Iowa medical cannabis patients seek cannabis to manage untreatable, severe, or chronic pain. These patients with severe pain need higher levels of THC to get relief. THC is the medicine these patients need. This is true for 9 of the other 10 debilitating conditions already approved in Iowa. As a result, patients are faced with prohibitive costs to buy enough low THC medicine in Iowa to get therapeutic benefits. Governor Reynolds' veto of House File 732 is already resulting in more people returning to cheaper, deadly, big pharma opioids, the illegal market, or other medical cannabis states with effective, compassionate programs. There is no reason to wait until next year to help the people that are suffering. By overriding the veto, the legislature can immediately help thousands of sick, vulnerable Iowans. The votes are there to do it. Legislators should stand by their votes, stand with the sick patients we all want to help, and put their welfare ahead of party and politics.
Thank you, Senator Bolcom. I'm John Forbes, pharmacist and state legislator here at the state capitol. Being a pharmacist for almost 40 years, I understand medications and how they work in the body. And I've studied this subject since 2013 when I was first elected and started working with Senator Bolcom on our first medical cannabis bill that we passed in, I believe, 2014. The bill that the governor vetoed here last week did a disservice to patients here in the state of Iowa. Many patients that are currently on the program were hopeful that by enhancing the THC levels that this bill would have addressed would better manage their pain. And being a pharmacist and talking with patients that are using the program today, I have one patient I know that comes to my pharmacy and has been on the program, but right now had to go off because of the cost involved in buying medical cannabis through this the current program. The bill that Governor Reynold vetoed would have made it more economically viable for patients to be able to afford medical cannabis. In this case, with this patient, he was able to reduce his dose of opioids by about 30% during the time when he was taking this medical cannabis product he was getting here in the state of Iowa. The cost got so prohibitive for him that he had to go off the program because he couldn't afford that over $200 a month for the medical cannabis program, and now has had to increase his opioid dose to control his pain. I don't think that's what Iowans want to hear. When we're trying to fight an opioid crisis here in the state of Iowa, we have now patients who have been on the program who can't afford it because of the high cost, because the way the program is now structured. We passed legislation that makes it more affordable and economically sensible for patients, and now patients aren't able to access it because of cost. This patient now is on a dose now about 30% higher than he was before. Is that right for Iowa? No. So I urge people here in the state of Iowa to contact your legislator, talk to them. They have the power to bring us back here to Des Moines to address this issue. But it's going to take people across the whole state of Iowa contacting your legislator, telling them how important this is for people here in the state of Iowa. And in many cases, most people in the state of Iowa know a person that has chronic pain and is on an opioid. And this would give that patient a better option to be able to access it at a more economical cost. Because as many of you know, this product is not covered by insurance today. And so I urge Iowans today to contact your legislators. We need 67 legislators in the Iowa House, that's 67 out of the 100 of us, to sign a paper to bring us back to Des Moines to address this. We need 34 senators to sign the same paper to bring us back here to Des Moines to address this and do what's right for people here in the state of Iowa. Thank you.
Representative Forbes and I'd be happy to take some questions. I would like to recognize a few of our colleagues are here. Representative Breckenridge is with us. Representative Kurtz.
Yes.
And Senator Claire Celsey from here in Des Moines. Anybody else? Thank you for being here. You've been great supporters of this. Any questions from the press?
Notably, no Republicans are here, and they've made it, the leadership at least has made it clear that they're going to start working on this for the next legislative session. What are the prospects? When you don't have Republicans, you have no prospects for a special session.
Well, we, as Representative Forbes indicated, I think we hope that patients and thoughtful Iowans will reach out to their state senators and state representatives who voted in a strong bipartisan way to improve our current program, that they'll put the welfare of Iowans, the welfare of sick Iowans ahead of party and politics. I know it's hard for people to come back here and override their governor, and that's an issue for Republicans. But I've lived through that back in 2006 when we overrode a veto of Governor Vilsack in a bipartisan way. And so there's a recent example, I think, where people stood up in 2006 and did the right thing, and we can do it here. I think what's at stake here is really far more important. People are suffering today needlessly. We can all come back together for an hour here at the Capitol and fix that.
You know, when this bill passed the Iowa legislature last month, when you combine both chambers, it passed 130 to 10. That's way over a 90% of state lawmakers here in the state of Iowa voted for this bill. And so we need to, as legislators, do what's right for people here in the state of Iowa. People are suffering, and they're not able to currently afford, in many cases, the program we have in place. It's a good program, but the way it's structured right now, it's not working well for a lot of Iowans. This bill, if the governor would have signed it, would have given better access to patients here in the state of Iowa. It would have also allowed nurse practitioners and physician's assistants to be able to write that letter of recommendation for patients. It's more of a problem in the rural areas in the state of Iowa also, where, and as Senator Bolkin shared this information with me, there's many counties where patients, there's only like 0 to 5 patients.
22 counties.
22 counties have anywhere from 0 to 5 patients, and it's in the rural areas of the state of Iowa. Allowing physician's assistants and nurse practitioners the authority to be able to certify and make sure that patient is eligible for the program would, again, enhance the program here in the state of Iowa and give better access to medical cannabis products to Iowans.
I've got a question.
We're going to, one second, we're going to take questions from the press, then we'll open it up. Thanks.
You're calling for a special session to override the veto.
Yeah.
Would another option be to come back in special session and do that compromise language the governor's talking about, trying to do next year, but having a special session to do that rather than all or nothing override?
I know the governor's medical cannabis board has recommended a 4.5 gram per 90 days for patients here in the state of Iowa. Unfortunately, a lot of patients need a higher dose of THC than 50 milligrams per day. There are some patients now being maintained on around 150 to 200 milligrams a day. So how am I as a legislator and a pharmacist going to tell that patient that's being maintained on a 200 milligram per day daily dose, I've got to cut your dose down to 50 milligrams? It's kind of like me telling you that if you're on a high blood pressure medication or a diabetes medication, I got to cut your dose by 75%. Is that good medicine? No. No, it's not. We can't do that to people in the state of Iowa. So that the 4.5 gram is not workable for people in the state of Iowa. Maybe a small percentage of people can get by on that low dose. But with all medications, you start out low and you titrate the dose up. That's how most physicians prescribe. You look at how the patient responds. And in many cases, it takes that 200 milligram or more per daily dose of THC to maintain that patient so they can have a quality of life here in the state of Iowa.
But would that be a topic for discussion in negotiating a new bill, a new approach?
I'm sure it'll come up, but as a pharmacist, I would have a very difficult time supporting what the Medical Cannabis Board is recommending to the governor right now.
Just one point on this. Iowa, there are 33 states that have medical cannabis programs that serve a variety of conditions. None of those states limit the amount of THC that's available to patients. There are about 16 states that we consider low THC states. Iowa is one of those. When in 2014, like a lot of states, we passed a law to help people with uncontrolled seizures. There's about 16 states that have done that. The challenge that we've had is in 2017, we added a whole host of, we added like 9 more conditions. And when we added those 9 conditions, we had to make the medicine stronger. And we didn't do that. And so, in fact, of the 11 conditions that are currently approved today, the medicine that's allowed in Iowa is really only effective in about 1 or 2 of those. So this discussion, we really need the governor, our board, her staff, to get up to speed on what's going on in the country and what's going on for patients. There are more than 200 million patients in this country that have access, 200 million Americans that have access to compassionate programs. We need to get there, and we're ready to work on whatever people want to work on, but people need to do their homework and come to the table with a deeper knowledge of what's going on in this industry across the country and what patients need. We need to get back to focusing on what patients need. And the board's recommendation is completely out in left field where that's concerned, as Representative Forbes has pointed out.
I want to just make a point too. I had twice asked for a meeting with the governor to go over this bill with her. She turned me down. I never heard anything about it. And that's very disappointing. As a state legislator and a pharmacist who understands this, she would not take the time to even meet with me to be able to talk about this bill. So I'm hopeful that in the future we can get together and come up with a good solution for people here in the state of Iowa.
Did she turn you down and just not reply?
She just did not reply. I put 2 requests in through her staff and never heard anything back from her.
Patients have also requested meetings with her, and they have not been able to get a meeting with her.
In her remarks yesterday, she indicated that she's opposed to legalizing recreational marijuana. Do you think that this whole thing is getting mixed in with a different topic, and that's kind of what's taking it down?
I think Representative Forbes and I have been clear about the need to help sick, suffering Iowans, and that is the focus of House File 732, and that's what we should get about and do. Bringing these other issues in around recreational use is making it impossible for us to make progress to help people that are dying, people that are sick, people that are taking the most powerful drugs imaginable with nasty side effects. I think it's an excuse not to fix this program.
Do you have, you mentioned maybe difficulty getting Republican support for a special session. Do you have full buy-in from the Democratic caucus for this?
I think we had every Democratic vote in both caucuses in support of the legislation. I don't expect any issues with our colleagues.
There'll be 47 letters coming back in from the Iowa House Democratic Caucus, and we'll need 20 more Republicans in the House to sign on to that letter to call for a special session, at least on the House side.
Do you know if any Republicans so far who've indicated that they're open to?
I haven't had a chance to visit with any of my colleagues on the other side of the aisle yet, but I will be after this press conference today.
Same.
If you fail to get the support for a special session, what can we expect to see? What efforts in the next legislative session?
Well, I did speak with Senator Tom Green yesterday, and Senator Green is a pharmacist from Burlington, Republican senator, and he is in complete support of the bill. Now, I don't know what he's going to do when he gets this letter to ask for a special session, but he did say he wants to work on it again next year. He understands that the recommendation from the Medical Cannabis Board is not workable for Iowans. The 4.5 grams is not a therapeutic dose for many, many Iowans. So hopefully through education, and maybe if I can get a meeting with the governor at some point in time, I can sit down with her and go through why this program and why we need to have that level of THC to be able to treat Iowans with chronic pain and other medical conditions. So that's my goal.
You mentioned in your opening remarks there were 32 states that had limits that were higher than Iowa's.
That's correct.
And then you recently followed back and said there are 16 that have no limits?
There are 16 that are considered low THC states. They'd have a limit like we do of 3% or less THC. And those states typically continue to cover just intractable epilepsy as the only condition that's allowed in that state.
But then the other 16,
No, so there's 16 low THC states that are very limited programs. We were one of those when we passed it in 2014. And then there's 32 other states, 33 other states that have full comprehensive programs. And what I say by that, I mean, they cover 10 to 20 conditions, and there's no limitation on the THC that's available to patients. And, you know, tens of thousands of Americans today are living in those states, getting the care they need with the medicine they need. You know, the alternative here to continue to have a program that's not effective, in the first 6 months of this year, more than 850,000 prescriptions were given in Iowa for Schedule II drugs. 850,000.
Opioids.
More than half of those are for opioids. There's a whole tier of different kinds of Schedule II drugs. 54% of those 850,000 prescriptions in the first 6 months of this year have been for very powerful opioids that are addictive, that cause side effects, that kill people. So the governor's comments yesterday about protecting Iowans from THC and cannabis as a much less risky medicine for people just doesn't stand up when the alternative is these prescriptions going out the door for these highly addictive, toxic medicines that are the only are the only choice for many Iowa patients. 22 counties, you have 0 to 5 patients. We know that the people have severe pain and chronic conditions that live in rural Iowa. Rural Iowans are not well served by our current program. Any other questions? Back here, we'll take.
Yeah, she's so blinded that, like you said, about the THC, she's so worried about the opioids. Is she so blinded that she can't see than just right here? I mean, is she for the opiates?
Yeah.
I mean,
No.
she is all for her, but I mean, how stupid is she? I'm sorry.
I think the problem is she's not getting good information, especially from her board.
Well,
Who's our board?
yeah.
The Medical Cannabis Board. It's a board that's 9 members. It has 1 law enforcement member, and the rest of the members are medical health professionals.
Okay, then let's hope to God that they get sick and they can't have any help like anybody
Yeah.
else. Then they'll understand.
There's no patients on our board?
Sorry.
There are no patients on the board. There were bills in both House and Senate to add patients to the board that did advance. Yes.
It sounds like Governor Reynold is leaning pretty heavily or standing behind the board's recommendation with her decision. I've heard that the board is yet to even visit any of the dispensaries. Do you know if that's true?
I don't know if
I'm
that's
not-
true or not.
I haven't heard that either way.
Yeah, my concern about the governor is that she's quit listening to patients. She's quit listening to Iowans about this issue. And that concerns me because there's a lot of improvements that we need to make this program comparable to other successful states. And generally when legislators do stuff, we look around at what's working other places, let's copy it and bring it to Iowa. We've not done that, unfortunately, with this program. So we know there's a number of improvements we can make, and we hope that she'll engage in a meaningful, open-minded conversation with folks about this. And I think what's important now is that in the next few weeks, all of you and people around the state that care about this issue reach out to their state senator, their state representative, and say, hey, get back to work for us. We can fix this. We can come to take a trip over to Des Moines for an afternoon. We can vote. We can be done. We can fix this for people and get this program working to help people. Louis.
My name is Bob Lewis. Everybody calls me Louis. I have carried malformation, cerebrophobia, cerebromyelina, and a degenerating spinal cord. I have enough going on with those conditions to not have to worry about pain. So for the last several years, I have been getting cannabis patches, the medical cannabis, illegally, which I will continue to do. I need a higher concentration than the law allows. And when she was lieutenant governor, I met her in the lieutenant governor's speech. She gave me a hug and said, I'm behind you. Well, I guess she's probably forgotten about that at this point. But, you know, one of the things that people ask me all the time, does it make me high? No, it does not make me high. I am still working, believe it or not, considering the condition I am, and I go to work 7 days a week, a few hours every day. And without the cannabis, my pain level would be through the roof. I have a high tolerance of pain anyway, which is good. If I didn't have the cannabis, I would have tears in my eyes because of what I have to deal with from a pain standpoint. So, you know, here we have, you gave the statistics about how many people in the legislature and the Senate voted for this. I would challenge each and every one of those people to get their rear end down here and do the right thing. You know, let's veto, get the bill passed, because, you know, I'm getting people all the time that are reaching out to me through friends. And I had a lady just this last week who I had talked with several months ago, told her what she needed to do. She's been living in chronic pain forever. And she did what I told her to do, and now she's in Arizona and they have a bill now. I'm not sure whether we got the high THC or the low, but I got an email from her the other day thanking me because now she has gone off of opioids. And so what's that worth? I mean, it's like, I hear that all the time. Now, not everybody that I've helped with information has been successful. It's just like the drugs. They're not always successful either, but I would say that 80% of the people that ask me for assistance, they get back to me and say, you know, it works. So I don't understand what the issue is. I'm in a position where I'm lucky enough to be able to get what I need, even though it's illegal. You know, I will continue to do that because my life is far better when I'm not having pain. You know, it's tough enough the way it is some days. So please, legislators, get back here, get this thing taken care of like you voted for in the first place.
Thank you, Louis. We want to thank everybody for coming. We want to thank everybody for coming this morning and all your work to get us to this point. We just have more work to do, and we look forward to working with you to get it done. Thanks so much.
Thank you.
Thanks, it possible to do